From looking at Alex's situation, I think the big issue is how we define enhancement versus treatment, because there's not always a clear answer, and we also need to know how to handle the gray area in between. From Dr. Wilmer's perspective, hormone therapy is considered a treatment. Alex isn't just asking for a cosmetic or something to make her look or feel better. She's dealing with really serious mental health conditions like panic disorder, depression, and even suicidal thoughts. If hormone therapy can help her reduce those suicidal thoughts and help her function again, then it fits in with all the other medical drugs that you would take, like an antidepressant, and should be clinically necessary. On the other hand, the insurance company would have a different framework. They would not consider a treatment. They would look at it through the lens of, does it count as medically necessary under their plan? To them, the hormones don't restore biological functioning the same way like insulin would for diabetes. So they classify it as an enhancement, something people might want but don't necessarily need, and so they don't have to cover it. They also have the financial side in mind. If they don't have to cover it, they're going to do what they can to not cover it, and they're obviously going to fight against having to pay it. Personally, I think the hormone therapy counts as treatment, not enhancement, because it addresses a real condition, gender dysmorphia, and it's not like taking a steroid where you're just doing it to try and look better, gain muscle. There's no real gain about it other than not having suicidal thoughts and living a normal life. It's not about getting an extra benefit. It's just about surviving normally. With that, I still think that there's some uncertainty. A big one is how medically necessary gets defined. Clinically, I think the case is strong, but insurance companies might have other definitions of the two, so this one could potentially fall in some gray area. And another is continuity. If Alex gets put on the 1-month treatment plan by Dr. Wilmer, but can't afford it after that, it could make things harder emotionally for her to be on it and then stop, like suddenly. If my advice for the next steps would be, the first priority would be Alex's safety, to make sure we reduce the suicidal thoughts and depression. So maybe something that could be medically necessary right now is psychiatric care and having therapy for her to talk to so that she's safe. Obviously that wouldn't be in the long-term plan probably, but I also think that the clinic should support her in her appeal to the insurance company, just because they're on the same side as her, and if they think that she really needs it, then they should support her and do everything they can so that she can afford this plan. So overall, I would say that this is classified as treatment, not enhancement.